First, thanks everybody. It's my great honor to have my lecture here. And I also want to thank the organizer. As you know, this is a neuroscience conference, but I'm not an expert in neuroscience. They like some fresh idea, so I'm here. Yeah, I'm an expert in geriatrics. So what my topic is today is the disease of sympathetic overdrive. It's a forgotten disease in neuroscience. I come from the first hospital of Jilin University, China. I have 4 parts in my lecture here. The first part is the introduction. As every doctor or researcher should know that every single organ, system, or even cell has 4 conditions, it including normal, disorder, disease, or tumor, right? Even cancer, right? But all of the tissue or cells like this? Not really. There's an exception. The sympathetic system doesn't have any kind of disease until now. Yes, I know. Yes, I know. Why not? You know, I have 40 years in clinical, but I don't know any this kind of disease happens in sympathetic system. Why not? It's not at all, or it's been missing. We should ask this question for us. Let's see what's the conception of a disease. A disease should have 4 parts. The first part is the risk factors. The second part is the clinical symptoms. The third part is the pathophysiology. Then goes to the clinical endpoints or even death. Those 4 parts can form a disease. So anything has these 4 parts, we should call them a disease, right? Let's see what happens in sympathetic system. First, let's see the effects of sympathetic system. Then we will see the outline of the disease of sympathetic overdrive and even the endpoint of the sympathetic overdrive. You can see this slide. Oh, yeah. You can see this is a list of systems sympathetic works on all the time, all your life, right? So if it has some problem about overdrive, it could cause a lot of symptoms. First kind of symptom including a first group of symptoms including overweight, high resting heart rate, high normal blood pressure. If those things cannot stop, it go forward, hypertension could happen. Then tachycardia, angina, coronary heart disease, heart attack, and even some bleeding stroke. Those things goes forward, you can have the case of chronic heart failure, sudden death, or even death, right? Those things happens throughout the world, all of the day, every day, right? But those things just happen in cardiovascular system. But we need to mention is there's other kind of symptoms in digestive system. First is the stomach ache. Stomach ache, just that kind of stomach ache that occurs very fast, just in 20 or 30 minutes or hours, because of sadness, tension, angry, or something like that. They have a very quick stomach ache, or along by the vomiting, loss of appetite, something like that, right? And even this kind of person can have some neurogenetic diarrhea or neurogenic diarrhea or neurogenic bleeding. This kind of bleeding, we have some case, very serious. It can bring to shock and even death. This would happen in digestive system. Let's see what happens in metabolic system. The metabolic system, the symptoms in metabolic system, including overweight, obesity, IDT, diabetes, and metabolic syndrome. Those things can go forward, have the results of chronic heart failure, chronic kidney failure, or even chronic remove, something we need to remove the kidney, right? So let's see what happens in mental and psychological system. The overdrive of sympathetic system can bring some insomnia. Actually, a lot of insomnia bring by this kind of reason. Depression, stress, anxiety, PTSD. Those things, if those things cannot stop, then goes to suicide. It's another kind of clinical endpoint in mental and psychological field, right? Let's see what could happen in immune system. The immune system, the ability of whole immune system is so close to, with the sympathetic system. If the overdrive occurs, they can have many things happen. I can give a simple example. If somebody gets sick, get sad, or get angry, they can have some kind of toothache in very short time, just in a couple of days. So if the overdrive of sympathetic system occurs, it can bring some virus infection or bacterial infection, right? If this kind of things last longer enough for several months or even longer, they can bring some cancer. In the cancer research, a lot of experts focus on the emotion and the relationship with the cancer. That's very, very hot topic. Let's see what happens in hair and the skin. Just like I begin my lecture here, I feel a little bit hot in my face. That's my skin rash or redness, right? This kind of things happens almost every day and many times in a person. You can't even count this, yeah? You have something good, something bad. You can always have this kind of things happen, right? But if this system hurted by very serious the overdrive of sympathetic system, we can see some case of green hair overnight in population. Very common. So the green hair overnight is a kind of clinical endpoint in the hair system, and it's the symptoms of the sympathetic overdrive. So we need to know this. Yeah. Let's see what's the risk factors for the disease of sympathetic overdrive. As I understand, there are lots of risk factors for the sympathetic overdrive. It can roughly divide into three groups. The first group is the social nature factors. The second group is the psychological factors. The third group is the lifestyle factors. And as I know, in my patient, there are a lot of patients that have even more than one or even two or three risk factors on just in the same person. Yes, right? They smoke, they drink, become very fat, they're binge eating all the time. So this kind of things quite often. But what I need to say is even a single risk factor could induce the illness in more than one system. And even if it's serious enough, they can bring sudden death in very short time. So let's talking about the pathophysiology of the disease of sympathetic overdrive. Of course, as this disease, the overdrive of sympathetic system is the basic or the main line of the mechanism. And also, there are many other related mechanisms that including oxidative stress, inflammation, RAS system, insulin resistance, HPAX. Just like what I say, the overdrive of sympathetic system, just like the main line. The other mechanism just surrounding the main line. Then they influence each other all the time. They work together all the time. So the sympathetic system works like a network today. Really like a network today. And so I think the disease of sympathetic overdrive looks like a network disease, not a single disease. Discussion a little bit. First, in neuroscience, let me try this. I don't know if I can say this right or not, because I'm not an expert, okay? The diseases in neurology are used to focus on central motor and sensory system in every details almost, right? But sympathetic system, it is a part of neurology, right? But they do not have any kernel disease until now. Why not? Why not? It's not at all, or we just missing it. We should ask this question. What I say is because between the normal level of sympathetic working system and the endpoints of the sympathetic overdrive, there are huge distance. You know, the end of the sympathetic system overdrive is the sympathetic stone. It's another name we called for the sudden death. So between the 2 points from the normal to the sympathetic stone, there are huge range. There are a lot of things happen. That's because the sympathetic system. So part of them can return to normal. We can call them disorder. The other parts do not return to normal, but just go forward until the organ damage or even to the clinical endpoint. We should give them some kind of name. So we give the name the disease of sympathetic overdrive. So we think we need this kind of theory for the next explore research, I think. So the neuroscience used to focus on line in body. But the disease of sympathetic overdrive seems a network, not just a simple line in middle, right? So sympathetic overdrive is a network disease in body because sympathetic overdrive causes a lot of problem in clinical. So it's a network disease. So we think it needs to explore further. Discuss in clinical. The hypothesis of sympathetic overdrive remind us the sympathetic system works on all the time on a list of systems, right? So we always suffer a variety of signs in clinical, a lot of clinical signs or symptoms, right? The second, the hypothesis of DSO to reveal the disease under the same framework. There are lots of disease under the same framework. So we offer the possibility to manage them, all of them, in the same way or under the same policy, especially during the first episode of this kind of thing happen, right? Third, the hypothesis of DSO to reveal the mental, social, lifestyle factor could induce both mental and physical disease on the same person. quite often. So I think the effects of the hypothesis of DSO could let us to avoid missing the forest for a tree. Discuss in medical model. You know, everybody has two eyes, normal person, right? The medical model, just like the, just like the eye for the doctor to explore the real world, the medical world, right? If we just use one eye, it's not good enough. We need to share them together. Then we get the benefits from both eyes, right? But in the real world, the doctors do not use these two medical methods together. They just use one, or just use this one, or more time use this one. They do not like to use the new one. Why not? I think they are missing something. Yeah, I think what happened in DSO is just like the nose. It connects the two eyes or the two metals in medical field, not too far away, not too far away, not to separate each other, but join together. And they separate the two eyes. Don't let them to join become one and lose the benefit. So I think that it's very important for us to understand the effects of the DSO, the hypothesis, right? That's what I'm thinking. I like more people to think about this way. So summary. First, it's too strange to miss the illness in sympathetic system as a disease of neurology. Second, the sympathetic system works wide and all the time. So if it suffers, it should be a very big and even fatal. We should know this, especially as I'm a doctor and in pediatric department. We always have this kind of thing happen. Third, the hypothesis of DSO is a new hypothesis, very fresh. And it could generalize a lot of diseases together. So may offer the clinical expert to share a better way or policy to manage them together, especially in the initial point, initial episode. So the hypothesis of DSO is a basic humor, a truth. I think we like you try to answer this for me, for us, and for all the neuroscience. Those list is the paper we published already. The first one in English, the other three in Chinese. And thanks for your attention. This is my address, email address. Thank you.